For doctors in the 1800s, the medical field was taking part in a rapid increase for jobs. However, the jobs were difficult to receive. Some early training into the field included traveling to other countries, universities, hospitals, etc. for good experience. Most future doctors of the time had interest from other family members in the medical field. The family would typically pass the interest down from a younger age in order to persuade them to become part of the medical field. However, surgeons or pharmacists needed to be experienced with hospital training or an apprenticeship in order to have a good job. Education was difficult in the 1800s, from requirements of universities, apprenticeships, studies in other countries, and experience in hospital training in order to get a good job in the medical field.
In the 19th century, doctors often carried out procedures inside a patient's home. During the procedure, a patient would often get sick and infected and even die because the doctor did not clean their equipment. During the surgery, the patients would often have to endure things such as amputations and bloodletting because anesthesia was not popular at the time.
During the early 19th century, most of the people perceived doctors in different ways. Some thought they were often too expensive and sometimes a joke to have them treat themselves and their families, while others thought it was their only hope of treating any illnesses or problems that they encountered. During this time, most procedures were done without anesthesia as it was not discovered yet, and surgeons used alcohol instead in hopes to relieve some of the patient's pain. The tools they used were often brutal, such as knives, saws, and needles to help remove the organs. Some procedures done back then were mostly amputations, as they thought it was the only way to remove the problem. Some amputations done in the 19th century were the removal of the legs, arms, and even the tongue if it had cancer. Some practices and ideas from this time were abandoned due to the fact that they were not effective or they did not help at all. One medical practice that was very common in the early 1800s was bloodletting. Doctors would use bloodletting to treat various diseases, and a very common way to remove blood was with leeches. Although doctors believed that removing blood would help treat the disease, bloodletting killed more than it actually cured. Recently, however, bloodletting is returning to treat specific medical conditions. Another medical practice that was abandoned was the use of mercury to treat syphilis. This treatment, however, had a variety of unpleasant side effects. Back in the early 19th century, the causes for disease were not clearly known. Many believed that diseases were caused by an imbalance in the body, and that an evil spirit could bring upon that imbalance.
Many practices from the 19th century are still used today. Leeches were once used to try and cure sickness and disease in the 19th century. This practice was known as bloodletting, releasing blood to try and cure sickness. There was a belief that it would remove diseases. Leeches are now used to help stop bleeding and reattach body parts, such as fingers. Herbalism is also used today. It is the use of plants and foods to help heal. Herbalism is one of the most commonly used practices today as well. Homeopathy was another practice used in the 19th century. The patient would be given a substance that would cause symptoms to a sickness. Although not as effective, it could still be used today as a treatment.